Hey guys, welcome back to the Total Knee Replacement Support Group YouTube channel. My name's Tony Maritato. I'm a licensed physical therapist. And since the last video I did talking about the 6 most common complications related to total knee replacement surgery did so well, I wanted to do another similar video talking about the most common questions or recommended questions you could ask your surgeon before deciding to have a knee replacement. Behind me on the screen, you can see Medline Plus. These are some great questions. I have a couple other lists that I'll do new videos on, but let's jump through a couple of these while we're here. I'm going to keep this video limited to about 10 minutes, so let's see what we can get through. Questions, and I think these are really great questions. Is there any harm in waiting? This is one of probably the most important questions to ask. Often I talk to patients who are having a knee replacement due to pain primarily, but then the secondary supporting factor is imaging that suggests the knee is deteriorating. Yes, the imaging can show what it shows, but at the same time, we want to make sure that is this the best time for you to have your surgery? Generally, the question about waiting comes down to a couple factors. One, are you at risk for more damage in terms of, are you going to fracture a bone? Are you going to cause irreparable damage that's going to make the surgery more difficult? But two, what about your personal life, your personal environment? Do you have a support system around you that can help you during the recovery? Is it the best time of year, even from an insurance perspective? Most deductibles and out-of-pocket costs reset at the beginning of the year. So you want to be sure that if you are going to have surgery, if you're going to have it and you don't always meet your deductible, maybe you wait to the beginning of the next year before you have your surgery. You want to think about weather conditions. We're here in Ohio. Certainly there's a lot of ice and there's a lot of snow in the winter, so maybe that's not the best time to have it, or maybe it is because you're going to be locked up in the house anyway, so you might as well be at home while you recover. Lots of things to factor in when you're thinking about waiting to have surgery or not, but absolutely ask, is there any harm in waiting? And if so, what would that harm be? You want to know, am I too young or too old for a knee replacement? Now, knee replacements are happening in younger and younger people every day. I'm seeing 50 and 40-year-olds who are having it. On the flip side, I also see people in their 80s who have a total knee replacement. So you want to balance that age-related risk with not having the knee replacement if it's not letting you do the activities that you want to do. We want to ask what else can be done for osteoarthritis or knee arthritis besides surgery. Now, certainly there's oral medications, there's injectable medications, there's splinting and bracing and different stuff. You can absolutely meet with a physical therapist to see if you can get on a pre-surgical program. We have had cases of patients that were scheduled for a knee replacement. They start doing things in a pre-surgical setting and they end up deciding they're not going to have their knee replaced. So there are things that can be done in an effort to either make the outcome of surgery better or prevent or delay having to have surgery. If you don't know about a minimally invasive knee replacement surgery, go ahead and start researching it. I have a couple videos on the channel. If you go back, you can check it out. But there are some real great advances related to minimally invasive. You could also look at, which type of knee replacement. There's a partial knee replacement. There's a total knee replacement. There's different implants and prosthetics. There's cemented and non-cemented. There's a lot of stuff out there you just need to research and look into before you kind of make your decision. And of course, your surgeon is going to be the one to talk to about all of those questions. So how much does a knee replacement surgery cost? The cost factor I kind of mentioned earlier, depending on deductibles, out-of-pocket max, there's certainly some financial impact that you might want to take into account when you're thinking about scheduling your surgery. You want to know if your insurance is going to cover it. You want to know if the entire team is participating with your insurance. There have been situations where the surgeon and maybe the surgical center is covered by insurance, but the anesthesia team is not. You just want to make sure everybody's on board and you know exactly what the cost is going to be. You also want to know if you have limitations on post-surgical care. So some Medicare Advantage plans will have a 20 visit limit for physical therapy services. In a situation like that, you might decide you want to have your surgery in October so that after surgery you get your 20 visits in. But if you need more than 20 visits in January, your 20 visit limit resets and you have another 20 visits available without an interruption to your physical therapy services. So there are lots of ways to get the most benefit from the benefits you've purchased. You just need an educated professional who can help guide you through some of that decision making. Is there anything I can do before surgery so it will be more successful for me? Obviously, as a physical therapist, I do a fair amount of pre-surgical therapy services. I think this is a huge opportunity to make your recovery just that much easier. Questions they're asking here: are there exercises I should do to make the muscle stronger? Yes, 100%. You want to look at both the health of the muscle itself, so doing things that improve the cardiovascular system. Remember, your circulation, your blood supply, that's what's going to help heal the tissue. So the better your cardiovascular system is working, the better chance of recovery. But then separately, you also want to consider the strength. We know you're going to lose strength with the surgery. We know that you're going to have pain and swelling. We know you're going to be less active for a while. So if you can build your strength reserves, then you'll lose less after the recovery or after the surgery during the recovery process. The most common kind of frustration is, well, how can I exercise because my knee hurts so much? That's where a physical therapist will help you develop ankle and hip exercises to minimize the compressive forces on the knee, but allow you to still work the muscles that surround the knee in conjunction with exercises that help improve the cardiovascular system. Should I learn to use crutches or a walker before surgery? I always recommend my patients get whatever assisted device they're going to have before surgery, so that if you have stairs at home, you can get used to going up and down the stairs with the walker. Here in the US, we primarily have walkers. In Europe, they use crutches quite a bit. But the idea is, yes, if you can get an assisted device before surgery and get comfortable using it, how you're going to get it in and out of the car. Are you going to have, two walkers, so you have one downstairs and one upstairs? These are the things that are better to work out before surgery. Do I need to lose weight? Wow, that is a topic that we just need to discuss in a completely separate video. I have some differing opinions on weight loss, weight gain, all of that, but the big factor here is, and I tell you this honestly, if there was an answer to weight loss, nobody would be overweight. Everybody would have the perfect weight and everybody would be healthy. But the reality is there is no single answer to weight loss. Everybody's different. Everybody metabolizes food and calories differently. There's hormone factors. There's chemical variations. There's so much stuff going on. Nobody has the specific answer to weight loss. It has to be a customized program. We have to understand the psychology, the physiology, the motivation, all of that kind of stuff. And then, of course, where can I get help quitting cigarettes and not drinking alcohol if I need to do so? We know that smoking cigarettes impairs your cardiovascular system. Certainly, it has issues and other, pro-inflammatory reactions in the body. So anything that you can do to make the body overall healthier is going to help. Alcohol and smoking make healing difficult. It's just that simple. So if you need help with those, managing those lifestyle issues, there's professionals out there that can do it. I would tell you to ask your surgeon about it, connect with a physical therapist, find the support you need, simply because it is going to be an impairment to your healing, to your tissue quality. So guys, we got through a couple sections. If you want more information like this, if you want me to answer more questions and kind of bring my 2 cents into it, let me know in the comments to this video. Otherwise, I will catch you guys on the next video. Thanks for watching.